Postpartum depression is the most common and serious mental health disorder for mothers. It usually affects mothers during pregnancy or in the first year after birth. Approximately 1 in 5 Australian women suffer from postpartum depression. Research has found that there are certain circumstances or factors that increase women's chances of developing postpartum depression. For example, previous mental health issues, financial and emotional pressures, and family history. Women can suffer from a variety of symptoms that leads to the diagnosis of postpartum depression, such as change in appetite, sleeping pattern, or mood swings. Women will usually experience numerous symptoms that lead to a postpartum depression diagnosis. This disorder not only affects the mothers, but it also impacts the lives of their partners and children. It has been found that children of women who suffer postpartum depression are more likely to experience temperament and behavioral issues and poor self-regulation, while partners are more likely to experience concern, fear, confusion, and a feeling of disruption that often causes them to make sacrifices to try and keep the relationship together. Because of the severity and prevalence of postpartum depression, it is often screened for regularly and throughout pregnancies and at 6-week postpartum checkups. The most reliable assessment tool used to determine if a mother suffers from postpartum depression is the Edinburgh Scale. There has been research that suggests that certain attributes can help minimize women's chances of developing postpartum depression or minimize its severity. Literature links back to breastfeeding helping both women and children in protecting them from the effects of depression and promoting bonding, as well as experiencing social interaction and having a strong support system. There are various treatment options available for women, including cognitive behavior therapy, group therapy, medication, or a combination of treatment that should be discussed with a healthcare profession to identify which treatment best suits the individual and that they are comfortable with. While the decision should be between the woman suffering depression and her doctor, there are many Australian websites and resources available for women and their families to access knowledge about postpartum depression and treatment options available to make an informed decision or gain insight into supporting the person affected. Postpartum depression is a common condition and there is help available. Seeking treatment will not only be in the best interest of the mother, but their children and families too. Asking for help takes strength.